I have the pleasure of speaking with Andre and DK, who is an account manager at Hushmail. And welcome, Andre, and thank you for agreeing to be interviewed today.
Yeah, thank you so much for having me, Dr.
Okay, so tell me more about Hushmail. How long has it been around? Are we talking months or years? Is it a well-kept secret or not?
No, it's not a well-kept secret. I don't think it should be pretty readily available. We've been around. I think we're going on 25 years.
Oh, that's
So
wonderful.
yeah,
Okay.
so there should be a big party around the corner. But yeah, and we're pretty close to that. I think we're at 23 or 24 right now.
Okay. Well, congratulations. That's no small achievement in this day and age. So tell me what Hushmail is, and why should medical providers and officers be interested in using your service?
Yeah. So Hushmail, we've been around for a while, and our main offering is HIPAA compliant email and secure forms for healthcare practices, and we work with providers ranging anywhere from small to medium is kind of where we focus. Small to medium practices, and yeah, we I think the big thing is we understand that for a lot of small to medium practices, typically they don't have dedicated IT professionals or team IT teams, and we hear constantly that whereas they might be focused on their specific practice and their work, the tech part of things can become cumbersome. So we try to fill that gap as much as possible through our customer care team and just making the experience of getting set up with HIPAA compliant email and HIPAA compliant forms as easy as possible. It's daunting for some people, and I have those conversations every day. And so we just try to make it as easy as possible for people to understand and work with.
Okay. So since you've been around for such a long time, do you have thousands of users at this point?
Oh, I don't know the exact number, but we're definitely over like a million. Like it's not,
Oh,
we're gonna hit
really?
that. Yeah, yeah.
Okay. So it's not only providers, but office staff and nurses and uh,
Yeah,
okay.
absolutely. So it ranges. Individual practices will implement the system in different ways. So we have people that will, have kind of dedicated, front desk staff using it and on behalf of the provider. But we also have setups where it's the providers individually using it, and they're all individually sending out forms, and they all have their own websites. But yeah, a number of different ways to set it up.
And I imagine your audience might include physical therapists, psychiatrists, psychologists, anybody involved in the well-being of patients.
Absolutely, yeah. So everywhere from general healthcare to mental health to physical therapy. So it's kind of it runs the spectrum for sure. Yeah.
Okay. So let's review some of the basics. The importance of HIPAA compliance for all involved is what again?
So yeah, I mean, it's just there are several items that you need for HIPAA compliance, and it's there's a lot. If you go online and you try to read into it, it can be a lot, like I mentioned earlier. So we try to make it as easy as possible. You definitely need a business associate agreement, right? If you're working with
Mhm.
any third party vendor that might be hosting personal health information, you need a business associate agreement. So that's included. You need email archiving. So you need a backup of every single email sent and received that needs to be stored um, separately from just the main. So if you have an email, you need an online backup of that email as well. It's not
Mhm.
enough just to have the one, right? So we provide that in our healthcare plans as well. And then encryption. You need to be able to send out PHI and secure information, in a way that's HIPAA compliant and secure. Encryption gets that done, and yeah, we have 256-bit encryption, which is far and above what is the standard or what's needed. So
Okay.
yeah, there's all that, and uh, I think what helps is, like I said, it's all just packaged in a way that there's nothing to solve when you come to the page. It's just how many email addresses do you need, or how many forms do you need. Um, that's the question to answer. It's not, oh, do I need a BAA or do I need encryption or you need all of that. It's just a matter of, yeah, how many actual email addresses or forms that you do require.
Yeah. And how does it operate? Does everyone get a Hushmail account? Can you use an existing email and direct it through a Hushmail interface? And perhaps most importantly, can one use a email service that we're familiar with, like Outlook or Gmail, or does one use a Hushmail interface?
Yeah, that's a great question. So, Gmail, Outlook, Yahoo, or I guess not Outlook. So let's say the free ones first. So the Gmail and the Yahoo and the AOL and those types of
Mhm.
email addresses. There are definitely services out there that can make those encrypted. Typically, they're a bit more costly than what you might be looking at something like us, where
Mhm.
we're a standalone email service, right? So with a standalone email service, it replaces that, right? So you're not going to be sending mail via Gmail or Yahoo or AOL. Instead, you're going to be sending it through Hushmail. Yeah, it's if you're used to though something like an Outlook or an Apple Mail, right? The default mail app on any Mac
Right,
device
right.
or Thunderbird or something like that, and you can absolutely use those as well. It's just a matter of adding your Hushmail account to that system, and yeah, we have a lot of people that do that just because it's what their team is used to and what they prefer. So yeah, it definitely works.
Okay. And you do have your own interface, which is it an app or is it a web-based service or both?
Yeah. We do have an app available for iOS devices for any Apple device. So if you've
Mhm.
downloaded that, then you can use that. Alternatively, it's accessible on any web browser, whether that's on mobile or on desktop. And I can show. I think we're going to do a bit of a demo, so I'll show you exactly what
Yeah,
that
that
looks
would
like.
be great. And
Yeah.
most importantly, let's say I have a Hushmail account, for example, and I wanted to communicate about a patient with someone who does not have Hushmail. That doesn't work. I'd have to get that person to also have a Hushmail account. Is that correct? It
No,
requires a two-way interface, or it can be a one-way.
no, that's a great question. We get that a lot. It's actually not required for the other person to also have a Hushmail account. What happens is, if I were to send you a Hushmail email, for example, on your end, let's say you're opening it up in a Gmail inbox,
Okay,
right? So
right.
in Gmail, instead of having the actual email, what you get is a link. It says read your secure mail. You click on that, and it takes you to a secure web page, right? Where
Okay.
you, as the recipient, will create the password for yourself, or we just released this. You can use like Gmail or Microsoft or Apple to verify your ID,
Mhm.
and then you can sign in that way. We find people are liking that a lot, and makes it a little bit more convenient. But yeah, I mean, it's ultimately what you want, anyways. Because if for example, I sent an email to patient X at their Gmail account, if
Mhm.
they were able to see the message immediately, if they see it right away, then all of a sudden, that's not HIPAA compliant. If there's any sensitive information in there, if there's any uh, PHI in that
Mhm.
message, then immediately that's exposed to the servers managed by Google or Yahoo or whatever it is. So we don't
Right.
want that to be the case. So instead of having your message and any sensitive information exposed, it's a link. You click on it, and yeah, and then it goes out to a secure web page.
Okay. And it can work both ways. So if I have a Hushmail account, I could send a HIPAA compliant PHI piece of information to another provider, right? And likewise, they can send it back to me, even though they don't have a Hushmail account.
Yeah, absolutely.
Oh, okay.
Yeah, so what's nice is we want you to be able to communicate things securely, right, to your patients or your clients, and the same thing,
Right.
we want them to be able to respond to you. And so if they were to reply to any
Mhm.
of your encrypted emails, then that would also be encrypted.
Okay. So you just said an interesting thing. So you're saying that I can communicate with a patient even if I have their email address, their regular email address,
Yeah,
right?
absolutely.
Okay.
Yeah.
Does it support texting, just out of curiosity?
Great question. No, it is something that we get asked about quite a bit.
Yeah.
but we currently are not offering encrypted text or HIPAA compliant texting.
Hmm.
Um, I think it's definitely an avenue that the team's talked about exploring, but not something that we have on the horizon at any
Right. Okay.
point soon.
And so a patient can send to me if they have my Hushmail email, a photo, a recording, a document,
Yeah.
pretty much anything, and it's encrypted and it's protected and it's safe communication.
Absolutely, yeah. So long as they
Okay.
reply to your message, then yeah, it's
Okay.
secure and encrypted coming back.
Okay. So before the demo, I'm curious, how affordable is it for a single provider versus a practice? Is it, monthly? Is it a yearly subscription? Does one just get a name at hushmail.com, or are there variations on that?
Yeah. So the single user accounts are like if you want just one email address, it still gets you up to two forms and everything else that you need for HIPAA. Everything I mentioned earlier, the BAA gets you the encrypted email, it gets you the email backup, like the email archive, so backup of every single email sent and received. All of that
Hmm.
together for just one email address is $9.99 per month,
Hmm.
or $109 if you want to pay for the year, right? So you
Hmm.
pay for 11 months and you get 12. And then if you're working with the team, our most popular plan is the 5 user, 5 form plan, right?
Hmm.
So you get 5 email addresses and up to 5 forms. And that comes in at $19.99 per month, or
Okay.
$219 for the year. So
And
it's,
extremely affordable. That's great.
yeah, yeah.
Okay.
Again, it's the main thing is we want it to be as easy as possible for people to be able to, um, get HIPAA compliant and to have all of the pieces all in one place. There is no, oh, do I need this and this and this and this? It's all just included in the package.
Right.
And yeah, even at the price point, it is definitely more accessible
Okay.
than, yeah.
All right. So I'm trying to remember. So does everyone get a your name at hushmail.com account,
Oh,
or
right.
is there any variation regarding
Yeah,
that?
sorry. You did ask that. Sorry. Uh, it's up to you. So if you do own your own domain, like you have a website and it uses, drdoolittle.com, then you can have an email address that uses drdoolittle.com at the end, right? So you could have admin at drdoolittle.com and we can help you set that up.
Mhm.
For us, so long as you already own that domain, it takes us 2 to 3 minutes and we can have you set up with that domain and you can be good to go. If you wanted instead to use one of our domains, and yeah, we have things like at hushmail.com, we have at hush.com. You could do at therapysecure.com, at counseling.secure.com. We have a couple
Oh,
of
isn't
options.
that wonderful? That is
Yeah.
great. So, for example, I've got MedGizmo's emails, so it could be set up such that everything that gets sent from MedGizmo's go through a Hush interface as it contacts either a patient or a provider or whomever.
Yeah, absolutely. You're right. Yeah, you could
I like
absolutely
that.
use custom domain. Yeah.
Yeah. So it's nice as a salesman when you have a product that virtually sells itself. Good for you.
Yeah. No,
Okay.
I know. And honestly, I'll be honest, coming into the job, it didn't sound, it didn't sound exciting, to be dealing with email. But I got to tell you, we, I deal with the best customers in the world here. Like
Yeah. Oh, good for you.
yeah, we did generally, we speak with a lot of therapists, mental health professionals, and just
Yeah.
doctors, professionals. So there's a lot of empathy and understanding and patience,
Yeah.
and yeah, generally
Okay.
it's really great to work with our customers.
All right. So sounds good. So you're not a startup at this point. You're in a established company.
Yeah,
Is it public? Is it private at this point?
that's private. Yeah,
Private.
yeah, it's
Good.
not a
Okay.
public.
Okay. And you haven't laid off any staff like a lot of
No,
these
that's
companies are?
Yeah, no, that's an absolutely valid question. No, we did go through, I think, we had that bell curve where during the pandemic, we saw a lot of, companies kind of go up and then, they, I don't know, they just kind of estimated what the projection would be, but no, we boomed, I think, during the pandemic because people were moving into telehealth. A
Yeah.
lot of people wanted to move into to secure online space.
Mhm.
And then since then, it's been good. Our support team, our customer care team, had to, I think, double or triple in size during that time just to be
Okay.
able to meet the need, and
Yeah.
it's just sustained. Yeah.
Yeah.